I'm Kelsey Davidson, and I'm a pediatric orthopedic surgeon. When I was growing up, I have a younger brother with Down syndrome, and so part of, I think, observing him growing up was seeing sort of the family interaction of how it is with kids with disabilities. And of course, through him then, I had a lot of interactions with like Special Olympics. I got involved in respite care, taking care of other kids with disabilities. I think the other thing that got me really interested in orthopedics was being a part of figure skating and having that involvement in sports, which got me really interested in the human body and biomechanics, and that just kind of was like a natural progression into orthopedics and then pediatric orthopedics. I still wanted to have involvement in figure skating, obviously in a different role as an adult than when I was a competitive figure skater, and I felt like being a sports medicine physician would still give me that opportunity to interact with figure skaters, interact with other athletes, to continue to help them develop, progress in their dreams, their sport, and try and keep them healthy and involved. So sports medicine in the most generic form is dealing with injuries that are related to sports. I think more specifically, sports medicine tends to look more at the cartilage and the supporting structures of joints rather than just the bones or the muscles around the joints. And so a lot of what we do with sports is surgeries that are inside the joints or doing physical therapy or bracing to try and protect the stability and the integrity of the joints. Unfortunately, there has been a trend in increasing injuries among pediatric patients. We think that it's related partly to sports specialization at a younger age, where kids are doing really repetitive maneuvers over and over again, leading to more chronic injuries because their bodies aren't really ready to tolerate that much single force. And we also think too that kids are doing more year-round sports, which the more that they do obviously increases the risk for injury. I think one thing that we're really lucky to have here is just this team involvement. To have physical therapists in the clinic and brace people in the clinic with me is a real luxury that not everybody gets. And so it's really helpful even for me if I have a patient with an injury that I think would benefit from physical therapy. The other thing that I think is really unique here obviously is our gait lab. We're starting to develop or use that technology more for kids with sports injuries to look at their mechanics with jumping, landing, throwing, and how we think that may contribute to their either risk of injury or re-injury after recovery. I think being able to really see a kid progress from when they first come to see me with a new injury or a disorder, and working with them over time to either understand what this means for them as they grow and how it may affect their life, to recovering from the injury and getting back to their sport. If you know any child with a sports injury or any other orthopedic need, we'd love to see them at Shriners Hospital for Children, Chicago.